Metabolic keys. Metabolic health basics. A lot of people are told they have insulin resistance only after the body has been compensating for years. The real problem is not just blood sugar. It is that the system can look functional while it is quietly getting less responsive. Research priority. Verify current claims against U.S. government websites for benefits topics and against the American Diabetes Association or other major primary institutional sources for diabetes and metabolic health topics. Insulin resistance does not mean your body stopped making insulin. It means your cells are no longer responding to insulin as efficiently as they should. To understand why that matters, picture insulin as the signal that helps move glucose out of the bloodstream and into muscle, liver, and fat cells. When those cells start ignoring the signal, the pancreas often responds by making more insulin to keep blood sugar in range. For a while, that extra effort can hide the problem. That is why many people feel confused when they hear the term for the first time after years of normal-looking routines. Over time, insulin resistance can push the body into a pattern where both insulin and blood sugar regulation become harder. The earliest issue is often not dramatic. It can look like fatigue after meals, increasing waist size, harder to control cravings, rising triglycerides, lower HDL cholesterol, or blood sugar drifting upward little by little. The body is working harder behind the scenes, even if nothing feels obviously broken yet. That is why insulin resistance matters so much. It is not just a buzzword. It is one of the core patterns behind prediabetes, type 2 diabetes, and a broader cluster of metabolic problems. One reason insulin resistance stays confusing is that the body can compensate for a long time. Someone can still be functioning, still going to work, and still eating in roughly the same way while the internal workload is rising. That makes it easy to dismiss early signals as stress, age, poor sleep, or just a bad month. In reality, the body may be fighting harder after meals, storing energy differently, and sending more appetite signals, while blood sugar still looks only slightly abnormal or not clearly abnormal at all. A person can be moving toward a more serious metabolic problem long before they feel like they belong in a medical conversation. In ordinary life, this can show up in frustrating ways that people do not always connect right away. Someone may feel hungry soon after eating, rely on caffeine to push through the afternoon, notice weight gain even when they are not eating wildly differently, or hear from a clinician that their fasting glucose, A1C, triglycerides, or liver markers are moving in the wrong direction. The point is not that every symptom proves insulin resistance. The point is that the pattern usually becomes clearer when lab trends, body changes, family history, sleep, movement, and eating habits are looked at together instead of one by one. One of the biggest mistakes is assuming insulin resistance is only caused by sugar or that it is simply a personal discipline problem. In reality, sleep deprivation, stress, inactivity, genetics, body fat distribution, medications, and overall dietary pattern can all play a role. Another mistake is waiting for severe symptoms before taking it seriously. Many people with early insulin resistance do not feel unmistakably sick. By the time the problem is obvious, the system may have been strained for years. For some people, the most useful clues are not dramatic symptoms, but patterns. Has fasting glucose been inching upward over multiple tests? Has A1C moved from comfortably normal toward the upper end? Are triglycerides rising while HDL stays low? Is waist size changing faster than total body weight alone would suggest? Are meals leaving you sleepy or hungry again very quickly? No single sign settles the question, and lab interpretation belongs with a clinician, but pattern recognition is valuable. It helps you move from vague worry toward a more concrete conversation about what your body may be signaling. A lot of people hear insulin resistance and immediately start looking for the most aggressive thing they can do for 7 days. That reaction is understandable, but it usually misses how metabolic change actually happens. The body responds to repeated signals. Repeated sleep loss matters. Repeated sedentary time matters. Repeated ultra-processed, low-satiety eating patterns matter, Repeated movement after meals can help. Repeated strength training can help. Repeated protein and fiber intake can help. In other words, the body is not grading one heroic week. It is responding to patterns. That can feel less exciting than a dramatic reset plan, but it is also what makes improvement more realistic. Viewers do better when they stop asking, "What is the perfect trick?" and start asking, "What signals am I sending this system most days?" If you think insulin resistance may be part of what is going on, a useful next step is to stop chasing random internet tips and start looking for a clearer map. That may mean reviewing recent lab work, asking what your A1C and fasting glucose have been doing over time, discussing triglycerides and HDL, and asking what pattern your clinician actually sees rather than reacting to one isolated number. The goal is to understand the trend, not just collect scary terminology. The most helpful first moves are usually consistent, not dramatic. Build meals around protein, fiber, and foods that keep you satisfied longer. Walk after meals when possible. Improve sleep where you can. Add resistance training if your health situation allows it. If a clinician recommends medication, ask what problem it is trying to solve and how you will know whether it is helping. Insulin resistance is not reversed by panic. It improves when the body gets repeated signals of stability over time. If you are dealing with rising blood sugar, a strong family history, significant weight changes, fatty liver concerns, polycystic ovary syndrome, repeated abnormal labs, or symptoms that are making daily life harder, it is worth getting more organized help instead of staying in self-diagnosis mode. Ask specifically what is being monitored, what the likely priorities are, and what follow-up timeline makes sense. Good care is easier to recognize when the goals are clear. You should not have to guess whether the plan is about weight, blood sugar, cardiovascular risk, medication timing, or all of the above. The biggest value of understanding insulin resistance is not that it gives you one more scary label. It gives you a better map. Instead of thinking only in terms of weight or only in terms of blood sugar, you begin to see appetite, waist size, lab trends, energy swings, movement, sleep, and family history as parts of one system. That matters because a better map changes behavior. It changes the kinds of questions you ask. It changes whether you chase gimmicks or track patterns. It changes whether you treat this like a character flaw or like a physiology problem that deserves patient, repeated, intelligent action. That shift in perspective is often the moment people stop spiraling and start making decisions that actually help. If you remember one thing, make it this: insulin resistance is a body state, not a moral verdict. It means the system is becoming less responsive, and the earlier you understand that pattern, the more choices you usually have. Clarity matters because it turns a vague fear into a problem you can actually track and respond to.